pushes on to raise the legal tobacco use age from 18 to 21 in Texas. Thanks for watching TMA's Legislative News Hotline for Friday, March 8th. Here are this week's headlines. A key piece of TMA's legislative agenda is heard in committee this week, and TMA President Dr. Doug Curran is there to voice his support to expand coverage for working Texans. A proposed grant program to improve access to rural health care is heard in a Texas House committee. The home of TMA is renamed in honor of longtime Executive Vice President Dr. Lou Goodman. But first, Texas 21 is back. Lawmakers unveiled two bills to raise the legal age to use tobacco and vaping products, one of which was heard in committee. Tobacco is the #1 preventable cause of death in Texas, and people getting hooked at a young age add to those statistics. Lawmakers and health experts say raising the legal tobacco use age to 21 years old is key to reducing smoking among young people and saving lives.
Raising the age limit to purchase and use tobacco in Texas could keep the harmful products out of the hands of underage users and save lives. TMA doctors joined others speaking for new bills to accomplish that.
It's time for our state to do something different, do something to protect our youth, do something to reduce the lifelong addiction risk and those that are struggling with chronic disease, and it is time for T21.
TMA physicians helped lawmakers unveil two bills, House Bill 749 by Representative Dr. John Zerwas of Richmond and Senate Bill 21 by Senator Joan Huffman of Houston. Co-sponsors include fellow TMA members Senator Dr. Donna Campbell and Representative Drs. J.D. Sheffield and Tom Oliverson. The bills raise the minimum legal age to buy tobacco from 18 to 21.
This is not the panacea when it comes to eliminating smoking, but it is an incredibly powerful thing to move tobacco products and the e-cigarettes away from these very susceptible young adults and adolescents who can very quickly become addicted to these products.
Supporters say raising the age limit is crucial because about 95% of smokers start before age 21. Every year, 65,000 young Texans under the age of 18 experiment with tobacco, and about 10,000 become regular smokers.
The chair lays out House Bill 749 and recognizes author Chairman Zerwas.
The House Public Health Committee heard HB 749 on Wednesday. TMA President Doug Curran testified in support of the TMA priority measure.
Sometimes we really have to give people more than just advice. We have to say we're just not going to go there, and we especially have to do it when we're talking about our kids.
7 states have raised the legal minimum tobacco use age to 21, along with 430 localities, including the city of San Antonio. Currently, the House bill is pending in committee, while the Senate version has yet to get a hearing. We'll keep you posted. Back to you.
A bill to expand health insurance coverage for millions of working Texans was introduced at the House Insurance Committee this week. House Bill 565 by Representative Garnet Coleman of Houston would expand Medicaid coverage for Texas working poor and ensure coverage for pre-existing conditions. TMA President Dr. Doug Curran spoke in favor of the bill, which could bring in an estimated $10 billion in new Medicaid funding. Texas currently uses about $6 billion to provide health care coverage for the poor and uninsured, but that source of revenue, the 1115 Healthcare Transformation Waiver, will expire in 3 years. Dr. Curran says it's time to take a new approach.
You know, we're really not interested in seeing an expansion of Medicaid as it currently exists. We're not happy with some of the managed part of that Medicaid, but if we can do it a different way, a Texas way, we think that we can design a much better plan where physicians can be paid rates that are appropriate for them, and then they can run their practices, and the circumstances will be much better both for physicians and patients.
The bill is pending in the House Insurance Committee. A new bill aims to serve rural and underserved communities by helping doctors train there, hopefully to stay and practice there. The bill, House Bill 1065 by Representative Trent Ashby of Lufkin, would expand Texans' access to care by creating a grant program for the development of residency programs in rural areas where they are needed the most. Of Texas' 172 rural counties, 101 are designated as primary care health professional shortage areas. 84 rural Texas counties have 5 or fewer physicians, and 24 counties have none. Odessa family physician Dr. Timothy Benton says the bill will help improve those numbers for rural patients.
Texas leads the nation in closure of rural hospitals and also rural hospitals at risk for closure. And if that happens, about 15% of the population will be in a new healthcare disparities group just by living in a rural community. So there's great need, and this bill would support adding physicians to the rural area.
The bill is left pending in the House Higher Education Committee. The Texas House passed a resolution this week recognizing a Beaumont doctor's effort to save lives during Hurricane Harvey.
It's indeed an honor today for myself and Dr. Zerwas to recognize Dr. Ray Callis of Beaumont.
Representative Joe Deschantel of Beaumont recognized TMA Board Trustee Dr. Ray Callis for receiving the American Medical Association's Medal of Valor for his efforts in the aftermath of Hurricane Harvey. That's Dr. Callis, second from the left there on the dais. Representative Dr. John Zerwas of Richmond co-authored House Resolution 630 honoring Dr. Callis. As expected, it's a race to the finish line as a flood of bills are rolling in before the March 8th deadline to file new legislation. With just a few hours left, we counted 7,576 bills filed this session. That's 5,113 bills filed in the House and 2,463 bills filed in the Senate. We will reveal the final bill count next week. A very special ceremony happened amidst the buzz of the first Tuesdays at the Capitol Day this week.
Changing the name of this building to the Louis J. Goodman Texas Medical Association Building is both appropriate and meaningful.
A who's who of current and former TMA presidents, trustees, and other family of medicine leaders jammed into the TMA lobby with elected officials and close family members on a chilly Tuesday morning. All came to honor a man they respect and love. TMA Executive Vice President and CEO Dr. Lou Goodman recently announced his retirement.
As Dr. Goodman retires from his...
Dignitaries read congressional, Texas Senate, and governor's proclamations heralding the man who has led TMA for 22 years. They also described the impact of his leadership and friendship.
Lou was always there to encourage and push and make sure that I didn't lose sight of what was truly important.
And all of you who are here for First Tuesday, he has led the way for so many successes that we've had, not just for doctors, not just for the medical, for the patients in this state that you and I care so much about. So Lou, thank you so much. We appreciate you so much for all you've done for the citizens of this state. Yes.
As I've worked with him, all I can tell you is he's just made me better. And I think he's done that for so many of us.
Whoa. I never expected this. These 32 years that I've worked with and for doctors have been really special. This is a great organization. And I can't think of a better career than working with the healers who save lives, who take care of people. It's truly an honor. I'm greatly humbled by this dedication.
Then, the moment everyone awaited and wanted to capture. Dr. Goodman is one of only 3 people to serve as Executive Vice President of TMA. The renamed TMA building now stands as a permanent reminder of his leadership.
Congratulations again.
Congratulations, Lou, and best to you in retirement. He plans to leave TMA once his successor is in place. Visit texmed.org/Lou to watch the entire building dedication ceremony. That's all for now. Please share this video with your TMA member friends and get the latest updates from TMA Daily Hotline in Texas Medicine Today and on Facebook and Twitter. With Marcus Cooper, I'm Brent Anir. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline.